button. So I'm going to go ahead and turn our attention to the older adult unit. And, normally we'll go through some content and then kind of have a CTE discussion. So we'll do a little bit of that in the time that we have left. But I wanted to jump into some asking you all for some additional feedback, but this time on the documentary that you all watched on Living Old, the Nightline documentary. Was everybody able to see that, view that, the one that was an hour? Not everybody, most of y'all should have watched it. Okay. It was on your list. So for those of you who did have the opportunity to watch it, or who chose to watch it, does anybody here work with older adults or has worked with older adults? I had quite a few people in class who had done that. Not everybody, we've spent the majority of this, it feels like anyway, a lot of this course talking about early childhood, infancy, pregnancy, birth, brain development, kind of the first 3 years of life. And, we have this one last opportunity to focus on, what's at the other end of that spectrum. Okay, great. You work. Okay. I see your note. Thank you. So we do have somebody who works with older adults online. So what I am curious about is, making sure that, we're really fully covering this whole spectrum of the lifespan. And, so we've started with birth. Now we're going to old age and death. I know there's a lot of social workers who work in hospice care, who work with families who are grieving, who work with, some people just simply sit with a person, and, as they die and provide companionship. There's just so many different opportunities for working with this population at all levels. And it's a lot of the content for this particular unit is focused on not necessarily the developmental aspects of it, but because that's part of it, but there's so many system issues that are present, almost more than children, because older adults are the fastest growing population segment of our country. Absolutely huge. And I'm going to go ahead and share my screen real quick, and we will jump over. I'll just go ahead and do it this way. So the percentage of the population of people who are 65 and older is projected to more than double from 46 million today to 98 million or more by 2060. So I am, when you look at numbers like this, it is, it's kind of, in some ways, a little overwhelming, or, you're just kind of saying, or maybe the opposite is underwhelming, and you don't even really understand, why we're talking about this or why this is such a big deal. And so I wanted to draw your attention to some of the factors around, why we are talking about this and what, what makes this such a significant issue for us. So one of the reasons is that the older population is becoming more racially and ethnically diverse. And a lot of older adults are working longer, both men and women, and those dynamics are really changing. Education levels of the older adult population are rising, which means that we have more of the people who are 65 and older have higher levels of education. So just from a cultural standpoint, in addition to a demographic standpoint, that can create a significant change. They may, advocate for policies that support them at a, higher rate, or they may, demand different kinds of services, or all kinds of things like that. And so from a policy perspective, all of these changes are very compelling, because when you're looking at, what are the rules essentially of society that govern, certain segments of the population, massive changes in one of those areas can create, the need for major policy change. That doesn't necessarily, just because a need is there, doesn't mean, of course, that a policy is going to address that need, as you all will discover if you don't know that already. But so when you look at things like from a policy standpoint, that the average life expectancy used to be 68 years old around 1950, and in 2013 was 79. And so I'm curious, what are some of the thoughts that you all have on, why that may mean, or what is the sort of the policy implications for such a huge change? And at 68 in 1950, before 1950, it was like 65. So it really has changed dramatically in the last 100 years. So we just have more people who are living at a very old age. Like in the documentary with the living old, you saw many of those people that would fall into this, population. So what are some thoughts that you all have for, what some of the implications for social work for some of these changes?
One implication is that if more people are using the programs, that means more funding would be required. Where are we going to get the funding? Are we going to raise taxes, or are we going to allocate funds from a different source of the national budget?
Mm-hmm. Right. Or require people to pay for the services themselves. Like if you go through the, if you have to buy independent, health insurance, that's like a whole other process than just, going through Medicare. So, that's a huge change as well. Yeah, good. What are some other thoughts?
I try to think of it in terms of how it could be a strength for our society, but we tend to have sort of a negative view of aging.
Right.
And I mean, that documentary didn't really shine a glowing light on it either. It was pretty...
It was rough.
It was, yeah.
It
really was. But I guess a hope I have is that we would, utilize that collective wisdom, maybe.
Mm-hmm.
I mean, as a source of, I don't know, a place to draw from for the future. Although I've lost a little hope recently in learning from the past, but that's all I had to say.
I think that's an excellent point. I'm glad you brought that up. And when one of the things that I find very hopeful, and have seen this firsthand before, is that when times are tight, when funding is tight, or there's like the recession, or just for whatever reason things are hard from kind of a social service standpoint, people and who work in this sector, and perhaps in business too, but they tend to get really, really creative and really innovative. And a lot of times you will see collaborations and innovations during those kind of dark times, so to speak, that you wouldn't see in kind of times of real that were more prosperous. Because you kind of tend to see some more complacency, or people just kind of tend to just sort of go along to get along. Whereas when they're really having to work for something, they might think about it more, or you might kind of create new opportunities for things like that. And so we've seen some really interesting innovations in, I think, that speak to your point about, actually talked about one earlier today, is, there are programs now that are looking at kind of partnering with, congregate care, kind of nursing homes, people where there's places where there's a lot of older adults, and partnering with preschools, and maybe even having very, very young children interacting with older people. And that those kids, maybe in foster care, maybe involved in the child welfare system, and not have grandparents, not have other kind of extended family members. So they can kind of provide, there's a lot of stimulation that can happen on both. That's very, very positive. A lot of social interaction that's extremely positive for both the preschoolers and the older adults. Also for, seeing programs for, kind of folks in college who kind of may get some funding for certain things by going and having interactions and spending time and basically working at the nursing home. They get a trade-off, but then it's in much more of a like kind of peer capacity by kind of forming lasting friendships and relationships with the older adults, and then the older adults get the companionship and social interaction that's extremely healthy for them. So I think that's a really excellent point. We this isn't, the graying of America isn't like isn't necessarily a bad thing. It's just simply I'm presenting it here as food for thought, and to really challenge us to consider, what are these changes, because they're massive and they're not going away. We have these very distinct generational changes, and so it really may mean that that there are policy changes, but also practice changes, and then also simply life changes. Like on the documentary, they spoke very eloquently, I thought, about some of the challenges for adults who are in middle age that are caring for both their children and their aging parents, and having to make decisions about care that previous generations just simply didn't have to make because people did not live as long. So people maybe weren't as stressed to kind of be in that kind of sandwich generation like they talk about. So that's a relatively new phenomenon, or at least the dynamics of it, with all of the healthcare and the expenses and things like $150,000 for a year of home care. That's extremely, cost prohibitive for the vast majority of our country. So there's a lot of things wrapped up in that, but I think that's a really, good point to say, we don't have to look at this in a negative light. There's lots of opportunities. So good. What are some other thoughts about some implications for this changing demographic?
I was challenged personally, had a little inner conflict, kind of going off of what you just mentioned, with that group having to care for their parents and think about their children. With the dignity and worth of all persons, I was wondering about, with some of the examples from the film, what I feel bad at saying, but what good is it doing? What is the life? What is the quality of this life, that is just kind of barely ticking, but then still feeling like, well, they're a person and they have rights and they matter. And but I was just thinking about the kind of health impact on those people who were trying to care for people that seemed in just going down slowly, and what that would mean for them and their families.
Right. I think that's, thank you for bringing that up, because I think you're teasing out one of the most critical aspects of this unit, and, why I wanted to spend so much time kind of talking about this is because the potential ethical dilemmas and ethical challenges, ethical conflicts, whatever you want to call them, that are present when considering the issues with this population are so vast, and in many ways more complex and more complicated than with any other population that we've talked about thus far. Because with children, we have some, laws in place that support things like parents make decisions on behalf of their children before they're age, 16. You don't really have a right to determine your own health care until you're, into your teenage years. But when people have dementia, for example, how do you align kind of a decreasing cognitive capacity or cognitive impairment with, like you said, dignity and worth of a person, but also things like self-determination, and, do no harm. If someone is living a very long time because of a kind of quote unquote medical catastrophe that they were talking about on the film, how do you reconcile that? It's very, very complex, because are you doing harm to that person by, allowing them or supporting them in living for a very, very long time when they even themselves have a very, perceived to have a very low quality of life. So it's just, it's complex, it's dense, it's heavy in my estimation. So I think, thank you for bringing that up. It's a really good point. What are some other thoughts?
One of
Can
the
I offer a personal?
Sure.
It's just this chapter in particular. I watched this firsthand, where my grandfather bought into that healthcare when he was in his late 40s and 50s, and it was designed so that he could remain in his home until he passed. Well, two things. I think he was very lonely, even though there were people all around. Mm-hmm. And the second thing was he outlived his care. He outlived what that home health care was designed for, to do. The needs met it, and so there was conflict about where he should be. And then I watched my mother, who was kind of the caregiver manager, and it wasn't just her; it was a lot of different people, and it was about an 8-year process. And that both of my grandparents have passed about 4 years, and the implications are still there that I see in my mother, because the lack of self-care that she didn't know how to give herself. Mm-hmm. And she thought she was doing the right thing ethically, spiritually, and it's taken a long time to come right back around. So this chapter was really, really close to home, and that was from someone who had health care.
Right.
And think about the thousands of people, and thinking about Medicaid and that going away with chronic illness. But like you were saying, I'm sorry, I don't remember her name. I was talking about the long-term ethical, implications and the quality of life. And it gets very gray when you start thinking about decision-making and slowly but surely turning over responsibilities, financial responsibilities. And yeah. So I absolutely see it. Yeah.
It's tough. Thank you for sharing that. There was someone else who was going to say something too.
Oh, that was me. Kind of in that vein, one of the places in the movie for me where kind of the ethics kind of broke down a little bit was with the daughter, who was talking about she knew her mother probably, could have not lived as long. They could have not, kind of kept doing the care, but she wasn't in a place to let her go and just let her die. And, my mom, she got into hospice because of taking care of my grandfather when he died of cancer. And she, after I think about 10 years in hospice, one day she just told me, I don't want you to keep me around, if I'm a vegetable. And I'm kind of in that same place. I don't know, as much as I know, quality of life, dignity of worth, I don't know if I could emotionally make that decision. It breaks down a little bit at that point, because how do you make someone essentially do what they feel like is killing someone and then tell them it's the better good?
Right. And I think another example that was, kind of came up earlier today, kind of along those lines, is, when it's no longer, so when you look at this through the lens of self-determination, well, if a person does not even kind of is no longer even medically responsible for making their own decisions because they've kind of given that right to a child through, legal paperwork, or they cognitively, the doctor, kind of can tell because of dementia or whatever that, they're not able to make these decisions for themselves. So then they do fall on somebody else. And, we go down this road, and it's very clear, it's very easy to go down this kind of slippery slope to, physician assisted suicide, and kind of what are the, at what point is that, something that you would, support for someone, maybe those people, that's actually for, people who are kind of cognitively present. But going back to the children who are caregivers for their aging parents is, do we consider a medical condition like the example in the film with the man who had Parkinson's, and one of the symptoms of his Parkinson's was that he lost the ability to swallow. Well, if you lose the ability to swallow, you can no longer eat. If you can no longer eat, you will eventually die of starvation. And so the family was faced with, well, do we allow him to simply, die of his own natural causes? Because that's a natural cause. It's not a heart attack, but it's a natural cause. Or do we put in a feeding tube and keep him alive and wait for him to die of pneumonia or a bed sore, kind of that whole medical catastrophe that he was talking about? That was a catastrophe born out of advances in medical care, as opposed to a death by a natural cause. And so is allowing someone to die of something like starvation because they can't feed themselves, is that different than someone dying of cancer or someone dying of a heart attack? And people who die of cancer suffer for, a very long time, usually in a lot of pain, but it's a natural cause. And it happens every day, and people do that every day. So is that really different than, another type of kind of natural cause? So there's, questions that until we're faced with them, either personally or professionally, may just simply not be on our radar. And so how do you prepare for the unknown, within your own families, but as a profession, where do we sit on all of these different issues, and how is it that we are going to, account for things like evidence-based practices when there's so many individual variations of what this can look like among families within this population, and so many different variables. So that's, again, one of the reasons why I say this is such a complex and complicated area. I think y'all are thinking, having some really good thoughts about this area. And I don't have the answers. I am simply putting it out there for you all to know and to consider and to critically think about, and realize that things are not always so black and white. And like you said earlier, that there's a real gray area when it comes to this population, no pun intended. So one last note about the average U.S. life expectancy increasing from 68 years to 79 years. Does anybody have, parents or grandparents who are on Social Security? I bring that up. You don't have to necessarily say, but I bring that up that, everybody, kind of pays in, at least right now, pays into Social Security, and then you're allowed to start drawing down your Social Security. And originally, when that law was first passed, it actually, I think it was originally either 62 or 65. And that age, from a policy standpoint, when they developed that and wrote that into law, they picked that number because it was the average life expectancy of the population at the time. So they simply it was very intentional. They picked that number because not so that people could retire, but so that, typically people were going to die. And so it just was kind of there. If you lived longer, like we expect you to die around here, around this age, but if you live longer, then you're going to be able to draw it down. But they thought that that was a good way to make sure that, it didn't bankrupt the system. But now we have so many people who are living much longer, and they have not, the average life expectancy now is 79 years. Well, you do not have to wait until you're 79 to draw down Social Security. They've increased it somewhat for certain populations, but still many people started drawing down back when they're 65. So when you have this huge segment of the population that's getting older and then not passing away and then drawing down Social Security, and then not as many people paying into paying into Social Security because of the people who are working right now who are younger, it's very, very out of balance. So from a policy standpoint, that's yet another reason why people are needing to be concerned about these demographic changes. So one other interesting thing about this population is the poverty rate. So the poverty rate has dropped sharply in the past 50 years, from nearly 30% in 1966 to 10% today for this population of 65 and older. Do y'all have any thoughts as to why that would be? Any guesses?
Well, I know my grandparents, they're both retired, and they both own homes separately, and they both had to go back to work because they couldn't afford it. The cost of living is more than it was back in the day when you can work for this so many years, you can retire, you can have a pension, and you'll be set. And a lot of companies aren't doing pensions anymore. A lot of the women went back to work. They weren't with a company that, had pensions for them. Because if it was in the 50s, women didn't really work. And then in the 70s and 80s, they were having children. And so when they went back to work in the 90s, they didn't have enough for retirement. So when they did retire, they're just focusing on one income, the Social Security, and that doesn't cover basic living. My grandmother had to go back to work and get a part-time job. So it's definitely the cost of living and the company's pensions, and everything's just kind of shifting and changing.
Yeah. And it's interesting that in light of those kinds of changes, that the poverty rate for 65 and older has gone down. So pretty dramatically, 20% down. So how would we look at that? So Sally, you said possibly the number of parents living with their adult children has increased. So maybe this is just simply a counting issue. Is that kind of what you're saying? Like, how are we how are we addressing that? Just from a research standpoint or a data standpoint, how are we even counting that? And it's interesting, kind of going back to, it's a little bit of a leading question. I don't have an answer for this, but one of the things I will say that it did make me think of and wonder about is if you kind of go back to our ACEs conversation, and you see that people who are born into poverty, how they are at risk of a number of adverse childhood experiences. It's not a determinant, but there's just simply increased risk. And so when you do have adversity, and especially the chronic stress of living in poverty for your entire life, the demographic and the life expectancy is increasing, but the poverty rate for this population is decreasing. And so it makes me wonder if it's simply because people who are in poverty are dying earlier. That if you just looked at the population of the country who were living below the federal poverty line, which is typically what we'll, use for that definition, what their life expectancy was. And if their life expectancy was also 79. So I do wonder if things like you mentioned earlier, access to healthcare, and if they don't can't get healthcare, are socially isolated, living in poverty, don't have health insurance, whatever these issues are, or they have simply the compounding effects of ACEs, and that we know if you have 6 or more ACEs, you are expected to die on average 20 years earlier than people with an ACE score of 0. So it makes me wonder from a just a tracking standpoint, what those differences are, and if that could be one of the reasons. Slides are not wanting to change. So I'm going to jump through some of these, and there are some pretty significant cultural differences. So I wanted to just touch on, I think there are some really critical issues around social isolation and loneliness in old age, and how they relate to mortality. And when you're working with older adults and you're doing things like going out and assessing, you're going to want to ask these kinds of questions. You're going to want to know, what their social situations are, because social isolation is associated with things like increased, cardiovascular disease, infectious illness, cognitive deterioration, which is a big thing, elevated blood pressure, inflammation, heightened inflammatory and metabolic responses to stress. So this slide always reminds me of kind of going back to childhood, or really, infancy, and when we're born, the, attachment relationship that happens between an infant, a baby, and the caregiver. Babies are born, we are all born, we are wired to be social creatures. We are stimulated by the social environment. So if you remove that social environment, just because we're older and have lived, socially, our whole lives, it doesn't mean that we don't still need that. And so we start to really deteriorate as a species when we are isolated socially. And it's just simply not how we were built to be. And one of the other issues is important is, sorry, I'm going to run through all these. We don't have time to go through all this. Is really looking at attitudes towards, kind of the cultural attitudes towards aging are also really important, and can impact things like how many social contacts do a person have. If, as in America, a lot of times, there is this sort of there is this kind of ideal that, you should respect your elders, but there's also this piece of, productivity equals value. So if you're older and you're less productive, then you may be considered less valuable. And I think it's important to challenge that for many of the reasons that we've been talking about. And so there's self-esteem issues. There's things that it's just like, if you're not valued, people may not be seeking you out for conversation. Your family may have moved away. There's a number of reasons why your social interactions and contacts may go down, and they're critically important to kind of overall health during this age range. So a couple more things I wanted to touch on. And y'all, please stop me. I'm kind of going to be on a roll. So y'all stop me if you have any questions or comments. Just speak up. But social relationships and interactions are really important to brain health. And we've talked a lot about the brain this whole semester, and we'll continue that trend with this unit. And one of the reasons that social relationships are so important, those interactions are so important, is because they stimulate our brains. And when our brains are stimulated, we are healthier. Our brains are healthier. We're going to have better health outcomes. And just as an example to put this in perspective, and you all can see the slides here, but when you are in, just every day now, so not when you're older, but every day now, when you are having a conversation with someone, you have to pay attention to that other person. That conversation and that interaction requires that you pay attention. It also requires that you maintain in memory the topic of the conversation. And what was said, 5 minutes ago, 20 minutes ago. There's a lot of different things that you're sort of forced to do that you do all of the time, and you probably are not even aware that you're doing. You may not be aware that you're adapting to the other person's perspective, and that you are, through the conversation, inferring the other person's beliefs and desires. Or doing things like assessing the situational constraints and acting on them, and doing things like, although obviously there's individual variation here, but inhibiting irrelevant or inappropriate behavior. You're kind of keeping yourself in check. You're making sure that you're not, kind of being, or doing things that may not be, fit within the context of that conversation. Is there a comment? I hear somebody took their mic off. Oops. Their comment? Oh, okay. So I am curious. Let me just see. Yes, exactly, Tyler. This does get back into neurons that fire together, wire together. So if you do this as, in your everyday life, it's stimulating your brain. You are, like right now, this minute, hopefully you are learning something and you're remembering what people said earlier in the conversation, and you're making all kinds of, you're having lots of thoughts and feelings, related to this different kind of incoming stimuli. Well, if you take that away, what is it that you are going to be, how is your brain going to be stimulated? And there's this other piece of research that we won't have too much time to delve into, but it kind of goes into this, kind of paying attention to each other. Older adults actually have better outcomes when they live with people that they are not related to. So a lot of people want to stay at home for many, many, good reasons, and, they don't want to lose their independence. But from a health standpoint, sometimes it's actually better to be in these situations where they are forced to interact socially with all of these people that they don't know. Because when you're with your family, and I think there's a great example on the film between the husband and wife who are living in the nursing home. One had Parkinson's and one had Alzheimer's. He was saying, she can't carry on a decent conversation. So he's kind of doing this thing where he's sort of tuning her out. And there's just not, when you've known somebody for 50 years or, someone is your child, you're not necessarily having to infer their beliefs and their desires. You just simply know what they are. You're not really having to adapt to another person's perspective because you know what it is, or you're already there, or even maintain in memory, what you're even talking about, or even pay attention. You may just, it's just simply not as stimulating as it is when you're being forced to do this because you don't know those things. So there's some interesting dynamics with this, just looking at where people live and simply someone's location can have a dramatic impact on their health status. And, kind of goes back to the good old prefrontal cortex and looking at all of these higher, executive, functions of our brains. They are calling us to do things, calling on our working memory, calling on our attention. And so when that is not stimulated, it's going to be this whole, you're going to run into this, especially at this age, this use it or lose it. Because if you're not firing those neurons, as you said earlier, they're not necessarily making new connections, or because our brain remains plastic, remember? So, we can learn new information for a very, very, very long time. But at some point you can start to just simply not remember things, or just simply your brain stops to function as well as it used to be able to. So there is this kind of constant feedback loop between social interaction and how that stimulates cognitive functioning. And then the cognitive functioning in turn, stimulates social interaction. Just kind of on and on it goes. So the more social interaction, the better, the kind of higher or deeper kind of cognitive functioning. And the higher the cognitive functioning, the more you're able to interact socially, carry on different kinds of conversations, meet new people, and do all that effectively. So there's a lot to be said. It's kind of social interaction becomes really, really important at that age. And just, one last point on that. There was some research done a few years ago that looked at the amount of social interaction and how it was predictive of cognitive functioning in the elderly. And they actually looked at younger participants and found that social interaction was as effective as intellectual activities in boosting cognitive performance. So that kind of is saying that social interactions are just as stimulating. So just hanging out with your friend, having conversations is, having dinner with someone is just as stimulating for our cognitive performance as doing an intellectual task or activity like a word puzzle or reading a book or something like that. So again, our brains are really wired to perform better when we have more social interactions. So any questions or comments about that before we switch gears a little bit?
This is just a little bit off topic, but what implication would that have for introverts?
Yeah, I know. It's a great question. It's a great question. That came up earlier today as well. So I am an introvert. I know you might be shocked, but I am an introvert. So I resonate with that question. But it's, temperament and personality kind of goes into the kind of the classic comment we've had all semester about individual variation. So, not everything applies to everyone. But just because you're an introvert doesn't mean that your brain is not stimulated by social interactions, right? It just means that you may not need as many social interactions as someone who is more extroverted, because you recharge your batteries by being alone, or doing more, just kind of spending more time in solitude. It recharges you and kind of gets you ready to go out into the world. Doesn't mean that you don't like to interact with other people. It just means where do you get your energy from? So, I think that's a really great question. I think it just means that, you still need the social interaction because you're human. You just may need different kinds or simply different doses is probably what I would say. Does that make sense? Does that answer your question? Would anybody else add to any of that? Any other thoughts on that?
I would just also say that those things you mentioned earlier, with the preschool kids and the college student exchange kind of programs, obviously have a lot of potential based on this research.
Yeah, absolutely. Because again, it's social interaction, but then it's different kinds, right? So if you add in, because if you think about a typical nursing home, you're interacting with other people your age, typically, or within 10 years or 20 years or whatever, or the nursing staff and the physician, who are also adults. So, and a lot of that may kind of tend to run together, but if you throw in somebody who's younger and who's maybe a musician or an artist or something, and you're doing different things, talking about different things, learning new things, and a preschooler who's going to be very different than, so then all of a sudden you have 3 different kinds or 4 or 5 different kinds or before of social interactions before you only had 2. So I think that can make, I think that's a really, really excellent point. So I want to kind of wrap up. This is, you can watch this later. You may have watched it already. We won't watch it, but no one's going to win any Academy Awards. But this video right here, it's a short little clip. There's some nursing students who did a kind of role playing around Elderspeak, and I want to put this out there because we've all done this at some point. For some reason, I think that we just sort of naturally do this, just like we do with kids. When we feel like someone is cognitively impaired, whether they're a child or they're older and maybe they don't hear as well, or maybe they even speak another language, we tend to do things like speak more slowly or use limited vocabulary or repeat words or phrases, or use terms like honey or dear or darling or sweetie. We just kind of change the way we talk. And there is a term for that called Elderspeak, and it really has some implications for the people that we're talking to, the people on the receiving end of that. And so it's something to be mindful of if you're dealing with people like this in your own family, if you're interacting with people in your own family that are older. And also, of course, if you're working with this population, is just to notice and be careful not to go down that road where you may not realize that you're actually implying that that person is not competent, like they're not capable of understanding you. Just because somebody is physically, declined in some way doesn't mean that mentally they're declined and aren't able to understand you. Or even if they're a little hard of hearing, or they're have some other kind of issue, they still can potentially comprehend you. So it's better to kind of assume that they can, rather than kind of leading with what essentially winds up looking like baby talk a lot of times. It also can affect an older person's evaluation of their own abilities. Kind of checking back and being like on the receiving end, you may say, well, wait, does this person think I'm stupid? Because I actually know what I want, but they keep telling me to sit down in this chair. But what I really want to do is go over to the counter and grab this thing, this other magazine, but they keep on telling me to sit down, and it's just like, there's just a number of ways that this can come out. Somebody mentioned kind of stereotypes earlier about aging. This could reinforce some of those stereotypes, and it also could potentially erode an older adult's self-esteem, and just kind of how they see themselves through our own eyes. Because if we're talking to them in these ways, may really, really not be helpful. So just some things additional things to think about. You may have not had a chance to see it because I just posted it this weekend, but because I just came across it. But I posted a short PowerPoint called Myths and Fallacies of Aging. They're biopsychosocial myths and fallacies of aging. So I encourage you, if you're more interested in this unit, which hopefully you are, that you just take a few minutes to look at that and look at some of those myths. You may find them helpful or interesting. So we have a few more minutes, and I would like to hear if any of you had any questions about the CTE. I've gotten a few emails from you all. I've tried to be responsive to, and just making sure. Yeah, I found a few emails that you've had questions about the CTE. So I just wanted to check in and see if y'all had any other questions before we signed off, or if you had any comments about your experience completing those CTEs. I did give you all an extension until next week. I'm still working to finish up your CTE 7s. I'm sorry that I haven't been able to. Yes, I'm glad you appreciate the extension. Good. I think several people did. It's just kind of that. I'm sure y'all have projects due in other classes as well. So So, but are there questions? I had quite a few questions just about kind of best ways to complete that and what readings were needed for that. So
I have a question.
yes,
It says it's like a self-reflection. So is this like kind of a first person?
yes, you can write
Writing?
in first person. Yes.
Okay.
Yes, you can write in first person. And some people, you may choose, because it's kind of about you and you're asking you to really reflect on your own family through the lens of this course material. So it's kind of asking you to apply this course material to yourself. So you may choose to pick a certain topic, like, certain health issues like Alzheimer's or diabetes or obesity or something like that, or physical activity or exercise. So we don't always we haven't necessarily had readings on all those different things. So if you need to go out and research and find some journal articles that speak to that specific issue, you all are encouraged to do that as well. Just trying to make sure it's recent and relevant. You're also welcome to use some of the previous units so certainly the supplemental readings that are there. There's really not that many readings for this unit. I was trying to give you all a little break. So you're welcome to use past articles, and of course the text as well. Are there any other questions?
I know it's a self-reflection. I'm more worried that I'm not citing enough, because it's like trying to find that balance between self-reflection, because I'm going because I have 3 generations before me, so I'm lucky enough to kind of see the effects along the line.
Yeah.
And I'm going to focus more on like the social and mental aspect of it. And I'm worried that I'm not citing enough. Like, is there
like a balance? Yeah. So this is a little, it's a good question. So this CTE is a little different because it is a self-reflection. So I'm not going to be as rigid and looking at kind of like the number of articles. I'm going to be more focused in this one to see basically, you're challenged to think critically about this. So that's really what I'm going to be looking for most, rather than, this person had, 8 citations and this person had 4, I think that you can reasonably, I think 4 is probably a pretty good number. I think 2 is probably not, I think you can challenge yourself to use more than 2.
Okay.
That's a really good question. And so I don't want to like throw out a number, but I would just say, challenge yourself to support your insights and assertions through those readings. And I'm also going to be, that being said, I'm going to be not as kind of strict as in past, because you can use the supplemental, you can use, past readings as well. So yeah.
I feel like I'm all over the place with it, but I where my departure would be from just looking at my parents' approach. And I kind of went with physical activity, because I felt like, well, that's stress reduction, and that's social interaction if done in an appropriate way. But I'm also banking on the fact that I'm not going to have chronic health issues that are going to prevent that amount of social interaction. So maybe I should just go with social interaction.
Well, I think I actually understood everything you were just saying. So I think part of your self-reflection is that I'm banking on this, or I'm banking on not having to deal with this.
Right.
So I think that's part of your reflection. So okay. I think that makes sense.
Okay. All right. Thank you.
Good question. Any other questions? Well, I have to say, I am a little sad that I have to say farewell to you all. I have thoroughly enjoyed having you in this course. I think y'all are brilliant. Y'all have submitted some absolutely fantastic CTE, some of the best that I have read out of all of my classes. So I'm very, very proud of all of you. And I'm really, really excited about what you're going to do in the field. And many of you will probably see me in leadership if you're kind of on that track. So maybe I don't need to be so sad. I can just be sad for neuro. So I will be happy to get to work with you in the future if I have you for leadership. I know I don't have everybody. So I do have everybody who's taking it next semester. I'll put it that way. So I have you, Stephen. Woo! I'm excited about that. So look forward to getting those syllabi. You will see them probably first part of probably second week of January or so. So I have so thoroughly appreciated your participation. It's been absolutely fabulous to learn from you all. And one last thing, I will implore you, and you will probably get 100 reminders about this, but I really, really, really value your feedback. And a fabulous way to do that is to just simply email me. I'm very open to that. Would love to have a conversation with you, but I'd also love to hear from you through the evaluation process that the university has, where you get to fill out a survey and a course evaluation at the end of the semester. So those will come out in a couple weeks, and I will send you the link. So I definitely really appreciate you filling that out. Regardless what you say, I want to hear it. I really do use those evaluations and the student feedback to make course modifications and corrections for future students. So that would be fantastic. So thank you all again. I'm here to support you throughout your time in the program, but also even after you graduate. Just know that I'm here to support your progress through the field, and I look forward to staying connected. I hope you all have a great evening. Bye, everybody.
I have a question really quick.
Oh, yeah.
Sorry. When will we get the grades for our CTEs? Because I've kind of waited to write mine until I
So I put in the announcement that I would have them by Wednesday. So that's still my goal. Yeah. That's part of the reason why y'all got an extension. Okay, it's only fair, right? Okay, any other questions before I say goodbye? All right, feel free to email me. Have a good night.